If you have been feeling more tired lately, more dizzy when you stand up, more swollen in your feet, or more awake at night than you used to be, the problem may not only be what is on your plate. It may also be what is in your glass. Some of the drinks seniors should limit for better health are easy to miss because they look normal, sound harmless, and may even seem healthy. But after 60, your body often handles sugar, salt, caffeine, and alcohol in a very different way. And one of the biggest troublemakers on this list surprises almost everyone because it is sold as a healthy choice. I'm Dr. Amelia Watson, and I want to make this simple. This is not about fear. It is about small changes that can help you protect your heart, your brain, your sleep, your balance, and your independence. Many older adults work hard to eat better, walk more, and take their medicines the right way, but they still feel off. Here's the part many people miss. Drinks can affect blood pressure, blood sugar, hydration, bladder control, sleep, and even how some medicines work. That matters because one habit repeated every day can quietly push your body in the wrong direction. Let's start with sugary drinks like regular soda, sweet tea, lemonade, fruit punch, and those fancy coffee drinks loaded with syrup. These drinks can send blood sugar up fast, and they add a lot of calories without making you feel full. If you already worry about diabetes, belly weight, tiredness after meals, or heart health, this matters more than many people realize. Some people tell themselves, it's only one drink. But one sweet drink every day can turn into a lot of sugar by the end of the week. And if you feel thirsty often, sugary drinks may not help the way plain water does. A better move is to shrink the serving size, choose unsweetened tea, or switch to water with lemon, cucumber, or a splash of juice for flavor. If this is helping you so far, let me know in the comments how old you are, or tell me which drink you have the hardest time cutting back on. I read those comments carefully, and they help me make the next videos around the real questions you care about. And if you want simple senior health tips in plain English, subscribe and stay with me, because the most overlooked drink on this list is still coming up. The next drink to limit is fruit juice, even when the label says 100% juice. Now, this is important. I am not saying juice is poison, and I am not saying you can never have it. But many seniors pour a large glass and think of it like water with vitamins. Your body does not see it that way. A big glass of apple juice, orange juice, or grape juice can bring in a lot of natural sugar very quickly, and because the fiber is mostly gone, it is easy to drink too much without noticing. If your blood sugar runs high, if you feel shaky after sweet foods, or if you are trying to lose a little weight, large servings of juice can quietly work against you. If you enjoy juice, think smaller. A small portion with a meal is very different from a large glass on an empty stomach. Another one to watch is energy drinks and very high caffeine drinks. This includes many energy shots, extra strong coffees, and some pre-workout style drinks. These can be rough on an older body, especially if you have heart rhythm problems, anxiety, poor sleep, bladder urgency, or blood pressure that already runs high. Here's what many people miss. It is not always just the caffeine. Some of these drinks also contain a mix of stimulants, a lot of sugar, or both. That combination can leave you feeling jittery, shaky, sweaty, or wide awake when you want to be resting. And if you are already tired from poor sleep, they can pull you into a cycle where you drink more to get through the day, then sleep even worse at night. If you notice your heart racing, your hands trembling, or your sleep getting lighter, your drink may be part of the reason. Now let's talk about alcohol, because this one can be tricky. A lot of older adults say, I only have a little wine at night. And sometimes that may seem harmless. But alcohol can hit differently as you age. It can dry you out, make you less steady on your feet, worsen sleep, and mix badly with some medicines. It may help you feel sleepy at first, but later in the night it can break up your sleep and leave you tired the next day. It can also make dizziness worse, and that matters if you already worry about falls. If you take pain pills, sleep medicines, anxiety medicines, or certain blood pressure medicines, this becomes even more important. Please do not stop any prescribed medicine on your own, but if you drink alcohol regularly, it is very smart to ask your doctor or pharmacist whether your medicines and alcohol are a safe mix for you. Here comes the drink that surprises a lot of people. Grapefruit juice. It sounds fresh. It sounds healthy. But for some seniors, grapefruit juice is not the right choice because it can change how certain medicines work. That means the drink itself may not be the problem, but the combination can be. Some cholesterol medicines, some blood pressure medicines, and a few other common drugs may be affected. This is why I always tell people to read the label on the medicine bottle and ask the pharmacist a very simple question: do I need to avoid grapefruit or grapefruit juice with this? That one question can protect you from a very avoidable problem. And please remember, do not stop a medicine just because you learn about an interaction. Talk with your healthcare professional about the safest next step. The fifth drink to limit is the salty kind that does not taste very salty. This includes some canned soups you sip like a drink, vegetable juice cocktails, bottled broths, and even some sports drinks. But there's another reason this matters. Too much sodium can make blood pressure harder to control and may add to swelling in the feet and ankles for some people. Many seniors are trying to protect their heart and kidneys, and these drinks can quietly push in the wrong direction. Sports drinks are another place people get fooled. Unless your doctor has told you otherwise, most people doing normal daily activity do not need a sports drink. They may get extra sugar, extra sodium, or both when plain water would do the job better. If you have kidney disease, heart failure, or severe swelling, it is especially important to ask what fluids are best for you. The sixth drink to limit is sweetened, healthy smoothies and meal replacement drinks that seem like a quick fix. Some are helpful in the right situation, especially for people who truly need more calories or protein. But many store-bought versions are more like dessert than a balanced meal. They can pack in sugar fast, and they may leave you hungry again soon. This becomes a real issue when someone is trying to control blood sugar, lose weight safely, or avoid afternoon crashes. Here's the simple rule. Do not let the word healthy on the front of the bottle do all the thinking for you. Turn it around. Look at the sugar, protein, serving size, and sodium. If you are using these drinks because chewing is hard, your appetite is low, or you are losing weight without trying, please bring that up with your doctor. Those can be important warning signs worth checking. So what should you drink more often? For many seniors, the safest starting point is plain water, sparkling water without added sugar, milk if it works for your body, or unsweetened tea. Some people also do well with coffee in a modest amount earlier in the day. Let's make this practical. If you want an easy habit that really helps, pick just one problem drink this week and change only that one. Maybe you switch your afternoon soda to iced water with lemon. Maybe you pour a smaller glass of juice. Maybe you stop drinking caffeine late in the day. Small changes are easier to keep, and the goal is not perfection. The goal is feeling steadier, clearer, and more in control. I also want to say this with care. If you are feeling very weak, fainting, suddenly confused, having chest pain, severe shortness of breath, trouble speaking, or one side of your body feels numb or weak, please get medical help right away. Those symptoms are too important to watch and wait on. And if you live with diabetes, kidney disease, heart disease, or you take several medicines, it is wise to talk with your healthcare professional before making big changes to what you drink each day. Your body may need a more personal plan. The good news is that healthy aging is often about noticing the small things before they become big things. Your daily drinks may seem minor, but they can shape how you sleep, how steady you feel, how your heart works, and how sharp your mind feels during the day. You do not need to change everything tonight. Just start by looking in your fridge, on your counter, or in your favorite cup and ask one simple question. Is this drink helping me, or quietly making things harder? If you know someone over 60 who keeps saying they feel tired, dizzy, swollen, or not quite like themselves, share this with them. And before you go, tell me in the comments which drink surprised you most.